Also tonight, right here on the news at 9, with Pfizer's vaccine here and now Moderna's vaccine expected to roll out next week. Up next, and boy, a lot of people, Heather, asking about the Johnson & Johnson vaccine.
That's right, Brandon. A lot is still unknown about it, but a Phoenix man who is part of the Johnson & Johnson trial gave his insight to our Brianna Whitney. She's joining us live right now to tell us what he had to say about it. Brianna?
Yeah, so the biggest difference with the Johnson & Johnson vaccine is it's one and done. It's just one dose and one shot. Doctors say that has its pros and cons, but they are expecting that to be a game changer, and that's why one Phoenix man wanted to be part of their trial.
Ryan Starzyk now has a new goodie bag.
This one is to test my oxygen, because I also have to put that information in the app. And here's the thermometer.
On Wednesday, he got the single-dose shot of the Johnson & Johnson vaccine as part of their trial through the VA, and now is being monitored by an app for 29 days before more blood work is done. As for side effects,
I've just had a lot of mucus coming out of my nose, but other than that, I feel fine. I would say getting the vaccine and struggling with some modest side effects probably outweighs getting the actual virus.
But the Johnson & Johnson vaccine is very different from both Pfizer and Moderna's. We spoke to Dr. Shad Marvasti and Dr. Paul Lynch about them.
One of them is using a virus to put that little RNA section, and one is using a ball of fat.
Pfizer and Moderna's use messenger RNA, known as mRNA, to send a signal to your cells to make antibodies. But Johnson & Johnson's actually uses another virus that goes into your body to create an immune response. Dr. Marvasti says the great thing about that is the one dose likely will be enough, but there's a downside.
You want to get the dosing exactly right, because if you have too high of a dose, you may get too much of a immune response, in which case you'll get inflammation and side effects that you don't want.
Dr. Lynch says he expects Johnson & Johnson's vaccine to be the greatest game changer, even though it's a couple months behind the others.
The fact that it's only one dose and it can just be normal refrigeration, if it works and the efficacy is as high as some of these other vaccines, and if the safety is just as good, we're going to be able to use this throughout the entire world.
Okay, so a timeline here. Dr. Lynch says likely in the first couple weeks of January is when Johnson & Johnson will release their efficacy rates. Then several weeks after that is when they'll likely release their safety findings. And then about a month after that is when we could see it approved and then rolling out from there. Guys, back to you.
So still very much in the process. And Brianna, what are doctors expecting to see with this Johnson & Johnson vaccine based on how the trial is going right now?
Yeah, so some good news on that front, Heather. Dr. Marvasti says Johnson & Johnson started their trial off with about 60,000 participants and now have scaled it back to 40,000. He says that's a really good sign because that likely means they're seeing high efficacy rates among their participants and they don't need as many people to show those good results. So we should see some good things coming soon. Of course, we've got Moderna and Pfizer, so Johnson & Johnson could be right on the horizon.
Let's cross our fingers we get another vaccine with another high efficacy rate. Brianna Whitney reporting live tonight. Thank you so much.